Hello everyone, I'm Dr. Prachi Kulkarni, fertility consultant, 49 Fertility Center. Today I'm going to talk about the ectopic pregnancy. What is ectopic pregnancy, why it may occur, and what should be the management of the ectopic pregnancy, what is the recurrence risk, and what to do after an ectopic pregnancy. So basically, ectopic means not in its normal position. So ectopic pregnancy, when we see in our patients, most common is the tubal ectopic pregnancy. So normal position of the pregnancy is inside the uterus. So the fertilization happens in the tube, but once the embryo is formed, the embryo has to get implanted and has to derive its nutrition and grow into a baby. So all that has to happen inside the uterus. So this is called as the pregnancy which is in the uterus is eutopic. U is normal. So normal position of pregnancy is in the uterus. So when we call it ectopic, it means anywhere outside the uterus. So most common, as I said, is in the tubes, fallopian tubes. So tubal ectopic pregnancy, if you have undergone any previous cesarean section or any hysterectomy or any myomectomy wherein the uterus has a scar, so there can be a chance of scar ectopic pregnancy. So other than that, the other positions of ectopic pregnancy can be ovarian pregnancy. Very rarely it can be an abdominal ectopic pregnancy, sometimes cervical pregnancy. These are the different types of ectopic pregnancy. So now we'll talk about the most common one, which is tubal ectopic pregnancy. So why the ectopic pregnancy commonly occurs in the tube? Because tube is the natural place. So tube are the natural where the egg and sperm meet in the body. So fertilization happens inside the tube. Once the ovary releases the egg is picked up by the tube, and after intercourse, the sperms which are deposited in the vagina travel through the uterus to the tube and fertilize the egg which is present in the tube. So tube has ideal conditions in the body, which is a little higher level of carbon dioxide, lower level of oxygen, and 37 degrees temperature. So all these are favorable conditions for fertilization to happen. So that is why the fertilization happens in the tube. That means the embryo starts forming in the tube. Suppose because of some infection or previous surgeries or endometriosis or tuberculosis, if the tube inner diameter is reduced in some places, there is a constriction in the tube, or there might be bleeding in the tube or saculations in the tube, what happens is this transport of the embryo back to the uterus now is not proper. So the pregnancy might get implanted in the tube itself. So what happens is the developing pregnancy tries to invade into the layers of the tube, how it does in the uterus, to get support to grow for the 9 months to derive the nutrition. So same thing it tries to do inside the tube. And because the tube is a very delicate structure, it doesn't have too much of a muscle layer, it may not be able to contain it. So what happens sometimes is this tube initially will get distended, and later on after some point it may rupture. So what happens if the tubal pregnancy ruptures? So there can be torrential bleeding, which might be life threatening as well. Sometimes we see patients with 2 liters of blood collection inside the abdomen when we operate for ruptured ectopic pregnancy. So this is the reason why we should be aware of ectopic pregnancy, because it can lead to torrential bleeding, which can cause a serious emergency, and you may have to undergo an emergency surgery, sometimes even the blood transfusions. And it can also be a life-threatening thing if the blood loss is too much and it's not detected in time. So what are the symptoms of ectopic pregnancy? So most common symptom can be a missed period, but sometimes even patients do not have history of missed period. They may just have little less flow compared to their previous cycles in this cycle, and may not be aware that they are pregnant. So UPT positive or beta HCG positive with missed periods, with abdominal pain, sudden giddiness, sudden attacks of dizziness and fainting at home, or shoulder pain, all these are symptoms, or sometimes even vaginal spotting bleeding. These are the symptoms of ectopic pregnancy. So which patients are at higher risk of having an ectopic pregnancy? So ectopic pregnancy is usually because it's happening in the damaged fallopian tubes, the patients who have had previous pelvic surgeries, First of all, previous ectopic pregnancy is the first leading cause of recurrence of ectopic pregnancy. Any previous tubal surgeries or any previous pelvic surgeries, any infections like PIDs, STDs, chlamydial infection, gonorrheal infections, which are sexually transmitted, these infections can be the cause for the ectopic pregnancy. Sometimes, if you have a copper T inside your uterus, the pregnancy cannot get implanted in the uterus and may happen it in the tubes. So these are the causes of ectopic pregnancy. So basically, damaged fallopian tubes due to any reason, previous surgeries, previous infections, even endometriosis, all these are the risk factors. In fact, smoking also is a risk factor for ectopic pregnancy in the tube. So what is the treatment for ectopic pregnancy? There are ways to treat ectopic pregnancy based on when we have diagnosed it. So if your pregnancy gestational period or the time of pregnancy is less, like around 5 weeks or 6 weeks, and that this ectopic pregnancy doesn't have a heartbeat, then your doctor may suggest you to go for medical management of ectopic pregnancy. The doctor might suggest you some blood tests, might admit you for observation, because if the rupture happens, then it's a emergency situation. So like if your vitals are stable, blood pressure, pulse, everything is stable, your reports are normal, then doctor may admit you and give you medical management of ectopic pregnancy. When do we go for surgical management of ectopic? It can be either ruptured ectopic pregnancy, or it can be failed medical management of ectopic pregnancy, or it can be a live ectopic pregnancy where we see the heartbeat also in the ectopic pregnancy. So these are ways to manage ectopic pregnancy. So please be vigilant. If you're missing your periods and if you have any of these risk factors, get your urine pregnancy test done as early as possible, get your beta HCG done as early as possible, and please see your fertility consultant to diagnose the ectopic pregnancy in time, so we can save the surgical emergency in such a situation. Thank you so much.